Well, boy, this whole dust-up over the health care thing and whether it was really worth the trouble, Bill Clinton kind of raised that as a prospect that there were a number of problems unenvisioned then that popped up. Then he had to dial that back in a speech at Ohio University just a few minutes ago. Hillary Clinton weighing in, saying there are things that have to be fixed, and she will fix them. Paraphrasing here, we hope to have that audio very, very soon. But no doubt it's kind of changed maybe some of the issues that might come up in the debate tonight between the number twos on each ticket at Longwood University here. Going to explore that a little bit with Dr. Ben Carson. Doctor, good to have you.
Hi, thank you, Neil.
Well, Doctor, you raised this in the campaign, and you, of course, were intimately aware of being and working on the front lines of health care, the limitations of this, the problems associated with this. Bill Clinton tried to dial that back today to say, yeah, but the fact of the matter is, as is Hillary Clinton, we had millions signed up who didn't have health care who now do. We're going to fix the stuff that's not right. So all these critics can just take a chill pill. You say what?
I say it was quite refreshing, although it was only momentary, to hear Bill Clinton telling the truth on this matter. The fact of the matter is, to rob Peter to pay Paul doesn't make any sense. To penalize millions of people in the middle class so that you can give health care to the indigent doesn't make any sense. You have to have a system that works for everybody. And as I've said many times before, you know, there's plenty of money already being used for health care, twice as much per capita as many other nations that have much better access. It's the system that is errant. And that's why we need a different system. Donald Trump is proposing a different system in which we take advantage of health savings accounts or health empowerment accounts, putting the decision-making back in the hands of patients and healthcare providers. If we bring the healthcare system into the free market, that's where you control price and that's where you control quality. As long as you've got more and more bureaucrats, there is no incentive to control it, and it never will be controlled.
What is the Republican view? What is the Republican view on this? And maybe your view, more to the point, since I don't have Donald Trump here, but do you think people should be covered for pre-existing conditions?
Absolutely. I mean, if we're humanitarian people, of course we should take care of pre-existing conditions. But we have a perfectly good mechanism for doing that if we use our brains and stop putting health care into the political arena. That's been the problem.
All right, because they come back, that is Democrats, sir, to say, well, until the Affordable Care Act came along, we had no such protections in place. Now we do. That alone, they say, justifies the expense, you say?
Well, I agree, but I was talking about that long before Obamacare came along. If you go back and read my books in 1999, I was talking about the need to take care of those kinds of issues. It hasn't been taken care of, so kudos where kudos are due. Yes, it did get it taken care of, but at what cost? So yes, we do need to do it. One of the problems with Obamacare is that the Republicans were excluded. They were locked out. So you really didn't have an opportunity to have these discussions. This is something that affects all of us. Why can't we sit down together and work out something that works for the American people and not for some political party?
Do you think Republicans should pivot hard right on this and say all those millions who got insurance, they're not going to be our voters? I'm being very crass here, but I did talk to a number of Republican strategists who said pretty much that. That's not their vote. They're not going to be running to the Republican candidate. And focus on those who are paying these sharply higher premiums, the group that Bill Clinton was addressing last night.
Well, see, I may vary with a lot of people in the sense that I don't think what we do should be, you know, Democrat or Republican. It should be American. Do we have an obligation morally to take care of our people? Absolutely. Is it something that's in the Constitution or the Bill of Rights? No, it is not. But we are compassionate people, and we take care of our own, and we have the ability to do it. If we didn't have the ability to do it, that would be a different story altogether. But we do. And we have the ability to ramp up our economy so easily. They say this is the new normal. There's nothing normal about this. You know, from 1850 to 2000, we grew at an average rate of 3.3%. Now it's half that or less. and they say it's normal. It's not normal. These regulations, this tax system, these have killed the entrepreneurial spirit, the innovation that made America into a great nation. We can bring this back.
So you think we grow at a stronger clip, and Donald Trump has a 4% annual growth goal, that will solve a lot of problems, health care included?
It will. Absolutely will, and it can. And it makes sense, and there's historical precedence for it.
All right. Doctor, always a pleasure, sir. Dr. Ben Carson, thank you.
Thank you, Neil.